Executive Media. Focus, innovate, succeed.
Ikop bakube babifanani.
Olikwenda bifanani birungi. Bakukube bakwize ti oli munoni. Omukolo bagukolere.
Olina kwandula.
Olina nankani bya wedding.
Olina graduation.
Nibo bofirirwa. So kwenda kukola nankani send off decent.
Wesimbye omukalulu.
Decent.
Funaba Ikop.
Abo bulwo bayito bataako.
Tubateeko tuli kujja mu kulonda.
Era tibasasula.
Be.
Kale.
Sasula.
Olikwenda bya bululu.
Yes.
Bakukube mukuba ni poster.
Ate bana.
Mukuba poster.
Olikwenda bana.
Bana dinedo kubutundu bali. Mu poster anguli mutunigira muko chali wife.
Ani. Chali wa imazira sente. Yasina n'okumuyamba oyo omusaada. Ikop.
Eri ekindi aba Ikop.
Olikwenda poster.
Kale.
Bana. Butundu bali. Billboard. Jamba na ife aba.
Business card.
Mudikola. Nti naba akole ne ya.
Nedo debeta bolochuwa.
Bolochuwa dindi.
Bolochuwa chechimu. Ne business card.
Ate kalenda.
Muwandika ku t-shirt.
Follow us on Instagram at Ecop Photography or call +256 702 935 078. Don't forget, they do it smart. Book with us today.
And branding at Print Creations. From custom gift sets to unique promotional items, creative signages and general printing, we've got everything you need to elevate your brand. Visit us at Chum Towers, Suite 70 on Kuruma Road, Lighthouse, Suites D14, D15 and F13. We offer a wide range of stationery supplies, awards and a vintage collection that stands out. Call us today at 0934 893 333 or WhatsApp 0702 683 317. Follow us on Facebook, Instagram and X at Print Creations. Print Creations, where quality, excellence and uniqueness meet.
The short and big shot.
Omumwa gonfukidde omumwa Zubeida. Kando night ogimanyi. Bagita kando night gwokutte gwobba.
Bawa wa sugar teyamazanye ku live.
Vamo jechiri. Vamo.
Bendera ddala.
Omusajja ate nga anakuswaza ajja kwana black sugar.
Abasajja munyiganga tebabati.
Noyingira n'atakubuuza. Ekibonyaabonya ababoda abasinga. Financial literacy. Oli abeera n'etaano ate nagenda n'akwanamu. Agala mutabani wange wakati w'emyaka alina okubanga ekyalo akikuttemu ekitundutundu.
Anayakola kimpanya n'alagako nno panda nti si wa muzannyo.
Ate kye nayagala ku ttiimu ya Mama Fiina.
Sente eziwaayo.
Naye tebasaba njawulo.
The short and big show. Abantu bajaagalira ddala. We always love you.
Hey yo, what's up my people? This is the baddest Azari right here on Executive Media with RealTime with Mimi. Stay locked in. Yeah.
So the same happens with the vagina. The vagina has got what we call the normal flora. There are bacteria that are meant to be in the vagina alone. And they play a very vital role in the vagina. The common one is called lactobacillus. Very common, but don't worry about the names. Lactobacillus produces acids in the vagina. So the vagina is an acidic environment. If someone has got the right amount of lactobacillus, it means that it is difficult for the other bad bacteria to grow because of that acid in the vagina. So if you change the population, it's like when you have soldiers. In Kampala, we had elections and all that. And then you have thieves who want to steal people's house, rob people's homes. And then you reduce the number of the soldiers. Of course, the theft increases.
Yes.
So it's the same happens with women. When you reduce the population of lactobacillus, the protection reduces. So the bad bacteria will increase.
So how do I decrease? Nzijawo ntya bano abasirikale nze. Lwaki mba mbajjawo me as a woman?
So that takes me to there are practices that we do that can affect the vaginal environment. And I'll come to that. So for us to say into oina infection, it means that the abnormal bacteria have increased in number and they are causing you to have symptoms that are usually not normal. Okay, so that's what people refer to as infections. And the bad bacteria can be in the vagina, but also they can enter in the urinary system. Okay? I usually like to, I think they will be able to show, the producer will show. But Zubeda, you will see that this is the side view of the structure of a woman, reproductive system. As you can see, this is the vagina, somewhere here. And then there is the bladder, somewhere here. And then there is a urethra, which allows the urine out of the bladder somewhere here. So the systems are near each other. Okay? If bad bacteria enters into the bladder, their numbers will increase because they're not supposed to be there. But when they enter there, they find nutrients and food, so they grow. Mango mango. When they grow, they cause symptoms. I wanted to gamba and that person has got urinary symptoms or urinary.
Subira buli omu ali bulungi kamera nkula.
Akulindemu omuntu bw'aba akola mulinde.
Wadde ogamba ki wamma? So Dr. Wiki eno tubadde nga baagala okumusubwa. So good morning, aliko Executive Media, subscribing, liking, bw'omala osharing. Eno bagiyita healthy chat. Tulina Dr. Eladdu, our trending doctor. Yaggulawo YouTube channel ne TikTok. Dr. n'abantu baayagala luli okutapinga ku gondiyo.
Ku YouTube.
Ku YouTube ne TikTok. Baagala okunyumyamu naawe one on one.
Okay.
Yes. So olunaku olwaleero tugenda kubeera nga twogera ku infections. Infections ekigambo kisookera ddala simanyi gye kyava. Me as a person, I grew up nga sikiwulirangako nti we have infections, nga sibiwulirangako ebyo nti tulina itching, tulina biki. So today I want to ask Doctor, where did that word came from? How did we start having those issues?
Okay.
So generally, what is infection in this era? Because in the other era we didn't have infections. Obanza atabitegeera, Doctor.
I will not say that. So our body is uniquely made. Okay. How God designed the body is in such a way that there are things that should not get access inside of the body. So you have layers of protection. For example, you have the skin, also, and that skin protects you from any unwanted organisms from entering inside the blood. Your blood is very sterile, okay? And sterile means that it should not make you sick. If your body is well protected, you should not have any sickness. If you breach this layer of protection, if you get a cut and then affect this skin, it makes you to easily get into trouble. Okay, so the skin is one layer that really protects us, but also we have a layer in the mouth called the mucus or the mucus layer. And the same layer is also around the vagina for women. Okay, so meaning that the whole body has got a bit of protection by cells that are not supposed to be destroyed. So when you have a breakage, if you get a cut on the skin, if someone is using some products that make the skin weak, all right, then that layer can easily be broken into, and then what was outside of the skin enters into the body. Now, the normal skin has got bacteria. You know, as you are there, you're not an independent person. You have guys or bacteria that are expected to be on your skin, and if they stay in the skin, they protect you.
Oh.
Okay? That's why some people, when you over affect that skin layer, then you remove that protection. Those bacteria produce oily secretions that cover the skin and make sure that you don't easily fall sick. So the same happens with the vagina. The vagina has got what we call the normal flora. There are bacteria that are meant to be in the vagina alone, and they play a very vital role in the vagina. The common one is called lactobacillus. Very common, but don't worry about the names. Lactobacillus produces acids in the vagina. So the vagina is an acidic environment. If someone has got the right amount of lactobacillus, it means that it is difficult for the other bad bacteria to grow because of that acid in the vagina. So if you change the population, it's like when you have soldiers. In Kampala, we had elections and all that. And then you have thieves who want to steal people's house, rob people's homes. And then you reduce the number of the soldiers. Of course, the theft increases.
Yes.
So it's the same happens with women. When you reduce the population of lactobacillus, the protection reduces. So the bad bacteria will increase.
So how do I decrease? Nzijawo ntya bano abasirikale nze lwaki mba mbajjawo me as a woman?
So that takes me to there are practices that we do that can affect the vaginal environment. And I'll come to that. So for us to say into oina infection, it means that the abnormal bacteria have increased in number and they are causing you to have symptoms that are usually not normal. Okay, so that's what people refer to as infections. And the bad bacteria can be in the vagina, but also they can enter in the urinary system. Okay? I usually like to, I think they will be able to show, the producer will show. But Zubeda, you will see that this is the side view of the structure of a woman, reproductive system. As you can see, this is the vagina, somewhere here. And then there is the bladder, somewhere here. And then there is a urethra, which allows the urine out of the bladder somewhere here. So the systems are near each other. Okay? If bad bacteria enters into the bladder, their numbers will increase because they're not supposed to be there. But when they enter there, they find nutrients and food, so they grow. Mango mango. When they grow, they cause symptoms. I wanted to gamba and that person has got urinary symptoms or urinary tract infections. If the bad bacteria enters in the vagina and their numbers increase, then they will also grow and cause symptoms of the vaginal system. Okay? Yeah, so ekigambo cha infection just means that you have bacteria that are not supposed to be in that place. So osobola kufuna infection in the blood. I think you've gone to hospital ne bagamba
na infection y'omusaayi.
Because normally the bacteria are not supposed to be in the blood. Your blood is supposed to be free of infection. So when bad bacteria enter the blood, then they will increase in number, then they make you sick. When tugamba ina infection yachi y'omusaayi. And that bad bacteria can enter from the skin, if the skin is broken, can enter from the respiratory system, the breathing. You can easily, if you're next to someone who has a flu or a cough, you can get that, it enters and then it accesses into the blood. I will not find an infection. You get it? So it can still enter from the vagina. Okay? So there are different places, openings. The stomach, you can eat food which causes you to have an upset, then the bacteria enters the blood, then often infection. So that is the blood infection. Now for the vaginal or the reproductive system, as infections, this is the reproductive system. Sometimes they can actually go beyond that system. Okay? Like I've showed you, that if someone gets an infection around the outside of the vagina, that infection can climb up paka ku bladder. If that person does not treat that infection, agenda paka ku kidney.
Hey.
Yes. So having infections and you don't treat is not a good thing, because the infection will keep on growing. If it enters the kidney and you have not treated, then it can enter into the blood. Vice versa, you can have an infection in the vagina and you don't treat. Many people run for herbals and all that. And then if you don't treat that infection, it climbs into the vagina, into the uterus.
And it affects the uterus.
Yes. If you don't treat it in the uterus, again, they call them the tubes. Then if it enters the tubes, it can even now go out of the tubes, what we call pelvic infections, or PID. You might have heard about PID. So anywhere you have infections or abnormal bacteria, you should treat. Okay? Yeah, so that's the thing about infections.
Okay.
They are not supposed to be there normally, but they grow and then they take advantage.
Okay.
Now, you asked me what makes you.
Yes.
So usually we encourage women that what we call good vaginal practices or good hygiene practices that help you to reduce or prevent infections. Okay? And the first one is how we clean ourselves after we have used the toilet. Okay? Again, from the anatomy or from the structure, there is where the urine passes, then there is the vagina, then there is the anus.
Yes.
So if you clean from the back, I don't know if you can see, but if you clean from the back forwards, you end up bringing the bacteria, because the anus, what comes out of the stool has got bacteria which are supposed to be only in the stomach. So when you clean from the back, coming in front, you can easily bring that bacteria to the vagina and to the urinary system. And when the bacteria enters there, that's a different environment for it. It can grow quickly and then definitely causes you to fall sick.
Infections.
Okay? Number 2 is hydration. Not drinking enough. Okay? Hydration is very important, because if you notice, women and men are different. The women have a very short urethra. The distance between the bladder and the outside and the vagina is very short. It's about 3 to 4 centimeters. But in men, your distance is about, let me see if I have, the distance is about 15 to 25 centimeters.
Yensonga lwaki balwawo okulira infections.
So if a man gets an infection, it takes it a longer time to get into the bladder. Whereas for women, it takes a very short time for that infection to get into the bladder. Now, when it is in the bladder, there is urine. Urine has got wastes, which the bacteria can feed on. Then they increase in number, mangu. then they start causing you symptoms. So hydration helps you to empty that bladder. As you empty, you're cleaning the urinary system. So, and it even helps, especially to frequently empty your bladder, especially after sex. Okay? For those who are engaging in sexual intercourse, ensure that maybe after the act, go and pass urine. Because when you do that, if there is any bacteria that was placed in the wrong place, you can easily clean it out. And also cleaning. In fact, the diet is also very important.
Which diet?
Okay?
We have to change our diet?
Not really change, but
discipline. Discipline.
You know, tugamba, as always, balanced diet. But the more you eat fruits, the more you have greens in your diet. Those usually help with the protection of the vagina and the mucous membranes, okay? When you are so much into the junk and the snacks and all that, they don't help the cells around that area to grow and to actually be protected. So our habits are very important, especially how we eat, how we drink, how we clean ourselves. There are people who like to clean inside the vagina.
Yes.
That is not
with
acceptable.
Even soap.
And now that's even worse. There are even others who put scents. Others who go for steaming and all that. All those are not good practices. Okay?
Steaming is not a good practice.
It's not. Because you see that area cleans itself. The vagina cleans itself. The best you are advised to do is clean outside, not inside. Because when you start introducing things inside, you know what you do? You're disorganizing the other population of the normal things that are supposed to be there. You're affecting the lactobacillus, and when you affect those ones, it means that you are putting yourself at risk. So women who clean inside the vagina, women who put scents and soaps, they affect the pH of the vagina. Okay? I think number 4, number 5, the underwears we wear. Okay? We advise women to wear, even men, to wear underwears that can allow that area to breathe. Okay?
Which one?
Like cotton-made underwears.
Not G-strings. Because even G-strings.
There's a lot of breathing.
Yes, a lot of breathing. And again, there is that cotton thing. Yeah?
Well,
have you ever seen a G-string, doctor?
I have seen.
Now, there is that cotton cloth that they put. We think that's what you're talking about when you say cotton.
Yes. Okay. Cotton of any nature is okay. And of course, I know that different designs of underwears,
yes.
Okay? The G-strings, there are those that are
netted.
There are those that are like Mother's Union and all that. But there are underwears that we don't like the polyester, the one which makes it difficult for air to get into the vagina. Okay? Those ones end up building heat and warmth around the vagina. As long as you build heat and warmth, then the other bacteria and fungal infections can start growing because of those underwears that we are wearing. So the more free they are, the better. In fact, we even advise when you go to bed, if you can not even wear the underwear, the better. Because it allows for fresh air.
Do they put on underwears when they're going to bed, do you think?
I do not know, but I know that people who might put on underwear. So, so the more you have a bit of aeration, the better for that place. It allows for the area to stay clean, and you don't allow bacteria to grow. Okay? Yeah. Then also there are people who like to gym, all right? Those who like to swim, all right?
Yes.
Yeah. After the gym, please just go and change. Okay? Don't stay in the same outfit for a very long time. Okay? Because when you stay, you've been sweating, okay? And bacteria like such things. When you're sweating a lot, they will take advantage of the sweat that was produced and feed on that and increase in number. All right? You've been in a swimming costume, change after. All right? And keep yourself dry. All right? The more wet you are and moist and all that, the more you're likely to put yourself at risk of some of these infections and all that. So these are just routine habits that we can change and prevent you from getting recurrent infections. Because I think that's the problem.
Yes.
Many people get infections, then after a short time, they're back.
Yes.
They're back. And for us, we say, as long as you have more than 2 infections in 6 months, or 3 infections in a year, we say you're having a recurrent infection. Okay? Yeah, but change those. Of course, what we eat, what we drink, some habits, the usual habits, the smoking, the alcohol, and all that, tone down on those. Okay, it helps improve.
So, Doctor, we must sobola kunywa mazzi. Like tulinamu abantu nga okunywa mazzi, it's our problem. Nga sobola kunywa lita 2 a day. Kati mba ngenda kukola nti.
Hydration doesn't mean only water. You can take juice. All right?
Okay.
You can.
Anti abatugamba okunywa batugamba kunywa mazzi.
No, but you see, you can take water in different forms because even juice has water. It's just that maybe the plain water is not flavorable. But when you take juice, your body will be able to get the water from that. When you take tea, your body is able to get water from that. Okay? Some people even spice the water. They put some lemons inside.
Yes, they put some mint.
Ginger, mint, and all that. But do those things that help you to actually hydrate. Because the more you hydrate, the more your bladder gets full quickly, the more you can go and empty that bladder, and then you're keeping yourself safe.
Okay. So, si mazzi gokka g'osobola okubeera ng'ate.
Yeah, but also not alcohol. Oyinza ogamba si mazzi, then say kale kanywe.
Dr. Agambye juice. Juice. So, Doctor, I have a question here.
Yes.
A lady told me she buys knickers after 1 month. Not disposing as abadde nazo, she buys new ones. But her problem, she gets burnt knickers in that month. The place where the vagina sits, wabera burnt. Nabuuza, does she have to worry? Does she have any problem?
Okay, so the burning on the knicker is a normal thing because if you're having a normal vaginal discharge, which is acidic, it sometimes can cause a bit of bleaching of some of those products around.
Okay.
Yeah. So that should not worry her. Okay? Yeah, that should not worry her unless if she maybe sees an abnormal discharge. Okay? And again, the discharge for women varies with the menstrual cycle. Before ovulation happens, the discharge can be a bit creamy and sticky. During the time of ovulation, it becomes clear and stretchy. Okay? And then after ovulation, it can become thick. Some even maybe may see whitish or something of that kind after ovulation. So it keeps on varying. But these are all normal discharges.
Oh,
you get it?
They're all normal.
They're all normal. We only get concerned if the normal discharge should not really have a bad smell, right? We only get concerned when that discharge begins changing color, becoming yellowish, okay? Or it's creamish all through, okay? Or now it's beginning, or it even becomes greenish. The people may have end up having greenish discharges. So when you notice that the color is not as it used to be, jangu kudwaliro. All right? Even before other symptoms come, you come and tell the doctors, I don't think my discharge is fine. They will be able to investigate. Then the smell. Like we said, the normal vaginal discharge, there's a specific odor for the vagina. But it's not really a bad odor, not a bad smell. Now, if it starts changing and you start smelling things that are not right, okay? Some can be things that are rotten. Some can be things like spoiled, like fish, okay? It's very strong urine smell, ammonia smell. Don't stay home. Jangu, let the doctors be able to investigate.
Okay.
The only problem is that many people come to hospital and instead of telling the doctor the right thing, they will say, I have an infection. And for us as doctors, we want to know, what are you feeling? What is not normal that you have noticed? No, because when you have a discharge, not every discharge is a UTI. Because I've told you, the discharge can come from the vagina or it can come from the urethra. Okay? Where the urine passes. So you need to be very specific. I have a vaginal discharge.
Which discharge?
What is the color of the discharge? How long have you had it? Then the doctor will now think of the right tests to do. And it's possible for you to have a vaginal discharge that goes into the urethra and causes a UTI. And it's also possible for you to have a urinary infection that goes into the vagina, nofuna vaginal infection. Okay? So it's very important to describe what you see and how you feel, because then that will determine the tests that you call. Because if you're having a urinary discharge, and usually the signs that problem it is specific to the urinary system is you feel burning, ngofuka. You find yourself urinating all the time. All right. You go and urinate and you feel like it's not yet complete. You want to go back again after a short while. All right. Or you feel some bit of pain once okay. If you've had the infection for long, then you'll start feeling pain on the sides. That usually means it means maybe the infection has gone to the kidneys. You get it, eh? Yeah, so the earlier you feel the symptoms, come to hospital. So when someone tells me those things, then I'm thinking this could be a urinary system. For the vaginal or reproductive system, the patient will tell us, I have an abnormal discharge, vaginal discharge. It is this color, all right? And it has persisted. Now, if you don't treat that infection, it can also go up. Agambye, it can go to the navana. Then you start feeling pain in murubuto. Then if it goes to the tubes, you start feeling too much pain on the stomach, on the back. Okay, you may even feel pain when you're having sex and all of that. So when you give me those specific symptoms, I can know that this is a vaginal infection. And the tests are different because if it's a vaginal infection, the urine test may not give us enough information. We need to do what they call a high vaginal swab. So Musawo asks you to climb on the bed, atekawo ka speculum n'ajjayo sample kubanga ekizibu kyo kiri ku discharge. So we want to see what is in this discharge and how can we treat it. See, buli infection is for urine test. Okay? If the Musawo thinks that
because waliwo ababeera ne infections doctor ne bakebera urine nga tebalina kye balabamu naye nga obulumi bukyajja alina discharge y'amaanyi.
So those ones we need to check the discharge. First we can get it, ne tutwala mu lab and we check. If it is recurrent, we can even take it, ne tukola what we call culture and sensitivity. Could discharge. So if you have urine, if you're having a discharge, an issue of the discharge, then the discharge must be tested. But I know, of course, sometimes people fear to be examined, or people go to the hospitals and the doctors don't really want to examine the patient.
Cancer.
It's a cancer mostly, but I know also there's a bit of issues of privacy. But if you do the right test, you are able to get the right treatment. If you tell me nti ogenze lero bakoze test y'omusolo temuli kintu, next time you go back you feel pain. Again they do a urine test, so you're not testing the right thing. If someone has urine symptoms, that's when we do the urinary test. If we find that waliwo infection kumsulo, then we give you the treatment for it. If we find that this infection is not getting treated, we can also do culture on the urine. Tugamba kale, this infection is taking long without clearing. Can we do a culture? Okay, so I want people out there to be familiar and to be aware of the different tests. You can test the urine, you can test the discharge. You can do culture on the urine, you can do culture on the vaginal discharge.
What's culture, doctor?
Very good. Culture is, because the biggest problem people ask, if you do a test, the biggest thing is some omuntu omugamba nti alina infection. Then she asks him, infection ki?
Nze zange ezitawona.
So the tests that we have, nga test y'omusaayi, test y'omusulo, and sometimes checking the discharge mu lab, cannot give us the exact identity of the infection. I can only know nti olina fungal infection or olina bacterial infection. Naye sobola kumanya which exact one. And the tests, those tests cannot tell us which treatment is the best for you. So when we do those tests, netusanga nti olina infection kumusai, we are likely to give you antibiotics which can cover many bacteria. We call those broad spectrum. They cover very many bacteria. But we have not found out the exact one. Kati, if we think that you're not getting fine, and we need to know which exact bacteria and which exact treatment, that is now where culture comes in. So when your doctor tells you to collect culture, it means ayagala kumanya which exact bacteria is this atawona, and which treatment can clear it. So, and culture takes days. Okay, So that's why I think why people sometimes fear to do culture.
5 days.
By the 3 days, otandika kufuna results. By 5 days, the results should actually be there. Usually it takes about 3 to 7 days. So if the doctor does culture, ayinza ogamba komawo after 1 week tulabe what results tufunye mu culture. Yeah. So that is what culture and sensitivity results tests mean.
So doctor, abantu abakyala balina discharge eringa amata, like spoiled milk, amata gafudde naye nga amata ogamanyi bwe gaba gafudde gekutula kutula naye nga galina ebitole naye nga tewunya. What's that?
So we can tell from how the discharge presents. We can it's like how we say how we describe maybe a car. Okay, Ntugamba, maybe how you describe a Mercedes car, or you describe, for example, how you can describe Mapera house in town. Teri kumpi city square, it's tall, it's this and that. So even us, from our training and practice, there are symptoms that of discharges that when a patient has, we know that this is common with, or this is usually produced by this organism. So for spoiled milk, amatanga gakutemuko, with some bit of clumps and all that, that usually points to a fungal infection, okay, or yeast infection. So and usually doesn't smell. You just find, and it can present with itching. Sometimes, all right. So you find that, and if you don't treat it, because those are the second most common bacteria in the vagina, but their population is controlled by the lactobacillus. So when the lactobacillus are enough and the acidity is good, we don't expect you to get fungal infections. When the acidity lowers, then the fungi or the yeast start growing mangu. And those ones, so those ones can grow very fast. So that specific one, milk, spoiled, clumps, and all that, mostly points towards fungal infection. And even how we treat it in that area. We use medicines for fungal. The problem many people have is omutafuna that discharge, agenda agula antibiotics. Agenda ku pharmacy nagamba ninawo infection. Doesn't explain.
Bayiga ne pessaries ez'okwesonseka wansi nadduka n'ateekayo.
At least those ones who use pessaries are even better. Now there are those who go and buy azithromycin, agula cefixime, or agula any other antibiotic. As long as you take the wrong treatment, tegenda ona. So sigaranga ki ng'okyafuna. The other problem is abantu bafuna treatment but they don't complete. Musawo kugambye use this treatment for 5 days. Where 3 days tokyalabayo discharge yonna and you stop. When you don't complete treatment, then whatever is left will start growing back again. And then the symptom comes. And then you'll come back after 1 or 2 weeks and say, and the infection, because you have not completed the treatment. Okay?
So, doctor, you said discharge must be smelling. So, if this yeast infection does not smell,
it is not must.
But kutuse. Naye nga omukyala waba afuka ng'eto eva namu nga bakola bagiyita batya? Urine tests.
Yes.
Bwe bamusaba sample era mugiramu discharge eyo eyekutudde ng'amata. Lwaki aba yeeraliikirira ng'ate n'okuwunya tebiwunya?
So the thing is, like I said, not all infections will give you a smelly discharge. For example, the yeast infections, the fungal infections, most times tewunya. Okay, it doesn't smell. But the symptoms, as long as you see, Nedda, this thing is not normal, it's increasing, I'm beginning to feel uncomfortable, then you come to hospital. All right? And you explain to the doctor, see, nina infection. Nedda, musawo mugambe, I feel ABCD. After maybe 2 or 3 days, I have started seeing something, it is whitish. So when you describe to musawo, asobola kumanya, this is likely to be this. Okay? It's like when you have a greenish discharge, or if you have a fish-like smell that is coming from it. The basawo are trained to know that kanoka symptom, it is specific for this.
Fish-like smell, baba tebakuloze.
People have so many issues that they deal with, and trust me, fish-like smell may not be. Some discharges that can point towards cancer.
Oh.
Nga cancer cancer of the cervix. So usually that one may be discharge that has a bit of blood. It smells extremely bad, like something is spoiled or rotten. Okay, and that person will tell you, when I have sex with my husband, I tell some blood. Okay, or I feel too much pain when I'm having intercourse with my husband. So you see, just the nature of the discharge can give them an idea and ask you, have you checked for cancer? And even can look into the cervix.
That word, doctor. Oba tugende funayo mukazi
Right, you to check.
Nadala cancer, wanabana.
In fact, it's good you brought it because January was cancer of the cervix awareness. Now, cancer of the cervix is the leading cause of deaths mugwanga wafe, Uganda, among women, especially in cancers. It's the leading cancer that causes deaths among women, followed by breast cancer. And the reason is, we don't want to go and screen.
We fear the news.
And the reason is, cancer of the cervix takes over 10 to 15 years to form. Does not just form into 1-2 days no funa cancer. It 10 to 15 years. If you were screening, if you were checking every 3 to 5 years, they can find it in a stage of cancer. And they can treat it before you've got just changed to cancer. Okay? The issue is, we don't want to screen. Screening. So if you don't screen, you will come when it is late. Cancer. So our word there is screen. When you screen early, we find it early, we treat no one. But when you wait for the symptoms, you're waiting for pain, you're waiting for blood, you're waiting for stomach issues and all that. Cancer tambude against stage 4 or stage 3. The stage that can be cured, even if it is cancer, is stage 1. Kasango ufunye stage 1 and the basawo check and confirm into stage 1. Even operation, I will know one bulungi.
It doesn't come back.
It doesn't come back. But when you wait for it to be stage 2, stage 3, mostly stage 4. Stage 3 and 4, it means that cancer tambude. It has now gone to nearby structures, or it has even gone to the brain, it has gone to the lungs and the liver and all that. By the time you come at that point, there is not much we can do for you.
So we should be screening after how many years? 3
to 5 years. So there are about 3 tests. There's what we call the HPV test, which you can do by yourself, Zubeda.
How?
They give you, there's a brush that you go to maybe the bathroom, and then you introduce it in the vagina, rotate it a few times, then you put it in the container, not to or not to lab. You don't even have to, it's not painful. You get it? That is usually for people about 25 to about 49 years. You test HPV DNA testing. Okay? It checks for HPV because that is a virus, a later cancer. Okay? So people out there should go and ask for this test. Then there's another one called a VIA testing. That one, it's done by the health worker. The Musawa asks you to climb on the bed, nakebera cervix. Waroka chemical jebateka mu cervix. When they put it and for about a minute, nebalengera cervix. If there is any change mu cervix, the Musawa will report Nagamba anti walo cervix no, there is some change. And they can treat you because that change does not mean into cancer.
You get the results there and
then. For that one. For HPV, it was a few days maybe. Now that one there and then. If they think there is some change, they can burn that area, and those cells are destroyed. I will know. Okay. Then, if there is a swelling on the cervix, they can remove a kanyama. Then they take it and see, is this swelling cancer or not cancer? Okay. And then finally, there's what they call the pap smear. Pap smear can be done for anyone, but mostly for people who are almost in menopause. That one, we again take off samples around the cervix and the vagina. Netusindika ku pathologist asoma na gamba nti nedda what you have done tewali cancer yonna. Okay, so when there are so many tests, you just need to go to hospital, then your doctor can explain to you.
So doctor, infections so kundetera cancer wana bana?
Yes, because HPV is an infection. And that HPV is transmitted sexually, especially by men.
I was telling them last time. Ntino bazunza cancer wana bana.
And that, yes, true.
But they denied.
No.
Men are ignorant about that.
They are. It is us, the men, who are busy transmitting the HPV from one person to the other. Now, HPV is ideally a normal virus, which, if your immune system is good, can clear it within 1 to 2 years. All right? But if your immunity is weak, it can stay there. And if it stays in the cervix for a longer time, it starts causing change. And then that change is the one what becomes cancer later on. Okay? So if for men who are circumcised, the transmission rates are few. They don't really carry especially if you're circumcised. It reduces the transmission by 30 to 40%. Men who are not circumcised, there's a high.
Are there still men who are not circumcised?
They are there. And they may even be watching. They may be watching your program. Yeah.
But you can circumcise if you're watching the program. Because that's not good also.
Yes. So, and you see, HPV can also cause cancer in men. It causes cancer of the penis. Mubasajja.
Jali.
Yeah. It is there. And when you come to hospital, you have cancer of the penis, we may have to cut it off.
You'll be empty.
You choose. Do you want to stay alive? Do you want to function?
No, you choose between the two deadly things.
So the men really, and so it's very important to get vaccinated because vaccination is there. We vaccinate people. Yeah, mostly government is focusing on young girls, 9 to 14 years, and boys. Okay, so both girls and boys can be vaccinated. Okay, but currently, I think as of recently, ministry has a vaccine for people who are children of 10 years. But that vaccine can be given even to women or people above 15 years. 15 to 45, also want to for a vaccine.
Yes.
Yes, you can. Yes, I think they usually give on the arm or on the thighs. I need to confirm. But the vaccine is not only for virgins. Even those ones who have had sexual intercourse can be vaccinated. And vaccines can protect you from getting cancer of the cervix for a very long time. Okay? So let us go and screen. And if you can, get off the vaccine, your HPV, because that vaccine can protect you from getting cancer of the cervix. Yeah. And it's still part of the infections, because these infections are not just the UTIs, okay? They are also STIs, okay? Gonorrhea, syphilis. Those are infections that can still disturb both women and men. And we need to really create awareness on those infections.
Okay. So, Doctor, omuntu wabeera nga alina itching on the walls.
Yes.
Talina pain, but the itching. What infection is that? You have infection over your candida.
So it depends. Sometimes the itching may be without infection. Okay?
Oh.
Yes.
But just ready.
Yes. For example, when the age really advances for women, for example, in menopause, there might be a bit of dryness caused by lack of enough hormones, estrogen. Okay? And that dryness can cause a bit of irritation on the walls of the vagina and a bit of itching. Okay? There are people who have skin allergies.
Yes.
Okay? The dermatitis and all that. And some of those
skin allergies can go still
some
down.
of them can also occur in the vagina. All right? There are some of those skin conditions that can present in the vagina that can cause itching. All right? And so not every itching is an infection, but it is best you go to hospital and then your doctor can check and see what is the area, what is it presenting like. If there is a discharge, can they take off a sample? Okay? But commonly, if there is a discharge with an itching, mostly that points towards a yeast infection or a fungal infection. Yeah.
Okay. So, abantu luli ne bacomplaininga ku luzungu doctor. Naye leero ndowooza mbakoze bulungi bwereere. Ebibuuzo byammwe byonna obudde mbibuuza mu Luganda. Si kyekyo? Abantu bagala doctor ayiga Oluganda kati. Waliwo abakolima ne bagala ne doctor asomesa ebintu ebirungi abamu tetubiwulira ate nga tubyetaaga. So, doctor, omuntu lwaki edda tetwafunanga infections? Like sawulirako ku kigambo kya infections. when I was young ne tugenda mu teenage age ngera toyina wokiwulira sawulyako maama wange nga bamujanjaba infection nkiwulidde kati.
So anyway, were the infections there? Yes and no. Okay? The yes could be that maybe our parents were taught that binebintu oyino guma. Somebody would take it. Because maybe there were no hospitals and all that, and maybe they had other things they would take and all that. Okay? So the access to healthcare was not very easy. I remember back when we were growing up, you would have to go kilometers, 10, 14 kilometers to mudwaliro. Kati oba otuuse mudwaliro osangayo line. Okay? So why don't you just kuguma and somehow take a few things and all that? Okay? So the infection certainly might have been there because these things have not just come recently.
But nga tetwajjanjabanga ezo vaginal infections.
Because most likely also because you were a child. You know, for children, they're not really exposed that much. And also, it's not like your hormones have, most vaginal secretions come to puberty. Okay? So a young child, it's very rare. We do treat UTIs and all that in children, but they're not as common as in adults because some of the hormonal changes of the body have not taken place. Because we know some of the hormones are the ones which are responsible for you to have increased secretions in the vagina. And also menstruation. Menstruation is a form of secretions, okay, in the vagina. Now, sexual intercourse can also predispose you to infections because we've said men can bring these infections. If they're STIs, we can contract them through during sexual intercourse. Now, maybe our parents were much behaved in the past in terms of how they used to eat, the diet.
Yes, the diet.
Okay, how they used to hydrate, you get it? They never used to have very tight clothing. They would wear their gomeses and which allows
tight clothes infections.
Because if they're tight, there's no breathing. The place does not breathe. If it doesn't breathe, then there's a sweat that accumulates. Yeast can grow there. Okay? Someone goes for a run and then stays in that thing for hours. Get it without changing. Our parents never used to do that. They would just go and dig maybe or something of that kind. You get it. And so there, of course, there are a bit of historic changes. Maybe what you can ask is, why are these things recurring?
Yes, they are treated, but people don't hear.
2, 3 things. One, people don't complete their treatment.
Ndio munange mbata completing.
You better change, reform.
I'm changing from today.
Reform. Because if
Miracle satu,
most times I tell patients, when they tell you into a urine infection, after treatment, go and do another repeat test. Go, just do another urinalysis. Tulawe, if the infection has cleared. Because if you're not sure it has cleared, you may find that the drug you used was not effective. It has just reduced it, now it has not cleared. So if you give yourself 1, 2, 3 weeks, right? So treat, but confirm. Again, say last week I treated this thing. I just want to be sure. So that is one, not completing treatment. Number 2 is that we are abusing drugs.
How?
Why? Because for you, any cough you have, omira antibiotics. Senyiga, which is viral infection, you're going to no good antibiotic, no mira. So the bacteria are getting used to these drugs. The echigambo we use is resistant. Because we are misusing the drugs, we are taking these drugs. Some of us even have Ogura Ampiclox, no mira, for 3 days, then you leave it there. When you feel cough, you say, again, of Ampiclox, it is there in my room, then you take. So we are misusing the drugs, we're taking them wrongly. Okay? And when you misuse those drugs, it means that when the time comes for you to use them, they are no longer effective. You remember during our days, you would use amoxil. And now, you can't just use amoxil because so there is a resistance, and we are the ones causing that resistance. Okay? So my advice is, if you're not fine, go to hospital. Don't go. Don't self-medicate because you may have fungal infection, yeast, or in a candida. You are swallowing the azithro. So the time when you need to use azithral, it is not effective. Your bacteria has got resistant to that treatment. So we are abusing drugs. Then the other one is we are, what can I say? We are, what's the right word? That we are not doing the necessary tests. Okay? Now this mostly maybe for the health workers. Someone comes nagamba ninawo infection go kola urinalysis. Buli kaseera okola urine infection. I mean urine test.
Ne CBC.
Yes, I don't know about the CBC, but I'm very specific for this. When someone has an infection, when someone has a symptom which is abnormal in the reproductive system, ask the right questions and do the right tests. Do the entire spectrum if you can. Advise them and tell them, let the patient be the one to say neda sagara. Because sometimes some patients come nagama neda musawo. Agambye chi? Yagala kebera discharge neda sagara musawo. But you inform them into oba ina infection. We need to check oba ina discharge. To know kebera discharge yo tulawe. What is it? Because a lot of people can tell. They can look and say this is yeast, this is bacteria. So that asobola kujanjaba bulungi. So we need to do the right tests. If you're not getting fine, do the culture. It might be expensive because I know cultures may be about 50, 60,000. Now you do it because it's cheaper than you buying a dagaria 20,000 consistently for the last 3 or 4 months. That's 80,000. If you do a culture, you find out which exact bacteria. I will know, and you take a long time without getting infection. Yeah.
So, doctor, do you agree with me nti toilets zesinga okulaza abakazi ez'okutuulako?
So, of course,
oba nedda?
It is a possibility.
Just a possibility?
Yes. Like I said, some of these things are not just like one specific thing. Could be personal factors. Nakugambye hygiene, okay, the way you clean yourself, and diet and all that. But some of them could be environmental factors. Okay? Definitely, you can contact this bacteria from other surfaces. Okay? Could be contact from a sexual partner.
Yes.
You get it?
That is obvious.
It could be, not necessarily.
It is
because
obvious.
most times when women come and say, Nina UTI, even my husband should be, now you do a urine test.
And you have a tell gang.
So, but contact is one of the possibilities. So even these toilets, when we have our places of convenience, let's keep them clean. Of course, the issue is when you are in the downtown and you're going to use those toilets. You can't. People just pee anyhow. Mtafuka on the surface. Then for you, just come and sit there. Then you get into contact with this surface. Someone might have had an infection. They have not treated for 6 months. Aliku habo 6 months. Okay. By the time you get that infection, it's already resistant.
But how do I clean the toilet which is not even mine? Abalala bazirinnyako nno doctor. Ey'okutuulako.
Yeah. Those even
ng'aganye tagenda funa infection n'alinnya ku gye batuulako.
Yeah, it's really hard. So if you can keep your hygiene of your toilet, of course, sometimes people in the market, you can maybe choose and say, for us we are 4 or 5, we shall use this facility. You get it, and you are responsible for it. Make sure it is clean. All right, they have cleaned the surface, not just on the ground until there's no water. Now even surface your toilet, make sure it is scrubbed cleanly. If you can use, because I know that the soaps, the many soaps, or the detergents that can be used to clean the surface. If you have your sanitizer, you can first spray on the surface and wipe it. And then if you have a wipe, you can wipe the surface. Then you can actually sit. Yeah, but I know it's difficult. There are people who put tissue on the surface.
Yes. They wrap the whole toilet with the toilet paper.
Yes. So by all means possible, it's sometimes difficult to avoid them, but minimize their use. Or use the toilet you're sure is really cleaned, okay, and it has a good hygiene, because you don't know what you're going to get. You'll get a bacteria and get resistant, and then you're the one who suffers with it.
Okay. So, doctor, kano kalalamu, women are inserting things in the vagina for sweetness. Advice from the ladies who sell local herbs. Even for infections, they advise some medicine to insert, but the local one to insert in the vagina. Chiri chichi echo. Is it risky also?
So, like
Any harm?
the vagina is a very delicate place, very delicate. Most of the things that you do, you have no idea that you are affecting that area. Okay? The scientific and the best advice is limits the things you introduce into your vagina. Limit them. Okay? Because some of these things, we don't know the compositions. We don't know if it will change the acidity of the vagina. Okay? We don't know how it will affect the cells of the vagina, the other organisms that are in the vagina. We don't know. Okay? So when you use them, you're putting yourself at risk. Then when you get these things, you actually now start struggling to treat them. So limit the things that you introduce in the vagina. The cleaning the vagina, the washing, the douching, I have seen...
Douching is not allowed.
We don't encourage douching. The vagina cleans itself. So just limit the things that you put in the vagina. That usually helps the vagina to recover. Okay? If you're going to put anything there, let it be recommended for a reason. If you have a yeast infection, then if they tell you to put pessaries, those pessaries have got specific medication to clear the yeast. Okay? And nothing more. All right? So my advice to ladies out there, make sure that whatever you're putting there, you know what it is. You've been advised to
By a health worker.
By a health worker.
So, doctor, someone sent me a message that she uses Dress V, but it burns.
So it Dress V contains an antifungal and antibiotic. It is given to people who may have mixed infections. So you can have a bacterial infection and a fungal infection. All right? If you have only a fungal infection, there is no role for Dress V. You get it? It's not helpful. So again, and you should, some of us react to medicines differently. Okay? And so when you're discussing with your msao, you tell him that I've ever used this and it caused me this, so that it doesn't give you the same. Because I can take Panadol. Recently, there was a patient of mine who reacts to Panadol. When you give injection to Panadol, the whole body gets swollen. And yet Panadol is one of the common painkillers people use. So people react differently to treatment. Your role should be to identify what is this medicine that makes me to have a reaction. Then you tell your doctor and say, Neda, last time I reacted to this. So your doctor should be able to choose other medicines, other options that cannot cause burning. Okay? Because ideally when we introduce these pessaries and these tubes, they should not make you worse. They should make you feel better and recover.
So it is not supposed to burn you?
They should not be able to burn you.
Okay.
Yeah.
So the same Dress V, it leaves those solid things in her vagina.
So the Dress V girl, because this is a girl, so sometimes we advise you. The pharmacists, when they give it to you, they will tell you when is the best time to use this girl. We prefer mostly when you're using these pessaries and gels when you're going to sleep. Okay? Because when you sleep, then this gel can melt in the body and then it is absorbed. Okay? The other advice is, of course, during the treatment of these infections, we don't encourage you to engage in sexual intercourse. Okay? Because as you're treating, if the other person has the infection, it comes back. You get it. But also, you don't want to give it to them, then get back from them later on. So during the time of treatment, at least abstain. Complete the treatment, and you're sure you're fine, then you can re-engage.
Yeah,
okay?
Abstaining.
Yeah, but then there are certain infections. For example, there are STIs. If someone has syphilis, someone has gonorrhea, someone has a PID, for example. Some of those infections, when we find you have as a woman, then we also want to treat your partner. You get it, eh? Yeah. So there are those, especially sexually transmitted infections, that we treat both partners. We treat the patient, we treat her partner. Either we write for you medicine, we write for him, tell him he should also take.
But they refuse to take the medicine.
That's why you should come with them so that we can explain to them.
They don't come to hospitals. They say women get their infections from town, from the arcades. So you want him to take the tabs. nga go waleeta ki infection kyo.
Yeah, but it might be him bringing the infection. You get it?
Nga ye alowooza toyi.
So sometimes I've had patients who have come to the consultation room, they get the phone call and say, Musawo, kwata simu. Speak with him. Then I have to tell the husband, Kati, we have found ABCD, we are going to treat your wife, but we also want you to take treatment.
Never would
Yeah, never would that. So by that time, when the woman goes home, she has less work. But I know sometimes the men can be very stubborn. When you are the one who is explaining to him, Kati, now we know
atandika okubuuza ondabyemu. So, doctor, when should a woman worry ngafuna recurring infections mu mwaka? When should I worry nti kati nfunye infections emirundi ng'etaano mu mwaka gumu?
2 infections
nga bazijjanjaba naye teziwona, like it's just recurring.
2 infections in 6 months should make you worried. If you get infections and within the next 6 months ofunye endala jangu kudwaliro, most likely we shall do a culture and sensitivity. If you've had 3 infections in a year,
you should worry.
That is a recurrent infection, so you should come, and then we need to do a culture and sensitivity. Yeah. So that's usually the definition of recurrent infection. More than 2 in 6 months or more than 3 in 12 months. Right? Okay. Yeah. So you cannot be using the same treatment every 2-3 weeks. You're using the same Dresv 2-6. No. You come and we find out, why is this Dresv not clearing this infection? Is it the right treatment? Because you may find someone is already resistant to Dresv.
So do I need to boost my immunity?
Okay, yes.
As a woman?
Yes.
How?
For immunity, and I think also this goes with what we call probiotics. Exercise is very good. Exercise boosts your immunity. Okay? So the more you exercise, the better your immune system forms and develops. Okay? How you eat boosts your immunity. Okay? Supplements. Okay?
We should be on supplements.
Not necessarily. If you're eating well, you may not have to be on supplements.
But if you're not eating well?
If your eating is poor, then it's very good for you to be, well, yes, for you to be on supplements. Of course, also comes with age. People in menopause and all that, they may need a bit of help here and there because of the effects of the hormones and age and all that. Yeah, but sometimes I've put my patients on probiotics. Okay, I'm sure you might have heard of things like cranberry, boric acid. Okay.
But even the cranberries, doctor, waliwo abantu abakozesa cranberries nga talina yadde change. But again, someone who sells cranberries told me ffe tuzikozesa obubi.
How?
Like we take them when we have infections. And he was advising that we should be taking even like on a daily. Is it okay?
Yeah, if you're someone who is prone to infections, the probiotics are not really harmful. You get it? Yeah, they just allow for the lactobacillus to grow in population. Okay, but we can also take the probiotics alongside antibiotics. The probiotics, if you have the infection, should not be taken alone. So to someone cranberry nogamba kale, the rest I'm not getting. You take them alongside the antibiotics that the doctor has given you, or alongside the antifungals. Okay, yeah, but studies have showed that these probiotics reduce recurrence of infections by 40%.
Oh.
Yeah, so that's a very big percentage. More than half. You come to TMR. They're actually cheaper in TMR.
Oh.
Yeah.
Okay. So as we wrap up, doctor, women get infections when they're approaching the menstruation period.
Yes.
Even in the menstruation period, even after. Hormones ziba zikendedde kibeera kiwala omukwano gwange afuna infection ng'agenda mu periods nga time enaatera like a day to the periods. Then in the periods nga z'amaanyi like itching, pain everywhere, even pain in the vagina. Then after the menstruation.
So for us, because the blood is alkaline. So the presence of blood tends to neutralize the acidity of the vagina.
Oh.
It's just like the sperms of men. They are alkaline. they usually neutralize the acidity of the vagina. Okay. Now, like I said, the discharge keeps on changing when you've just finished your periods, during ovulation, and after ovulation. Okay. So the discharge will keep on changing, and definitely, if you're having infections happening immediately after you've had your periods, we need to look into that. Okay. We need to do take off what we call a swab sample of the discharge and look at it. There are common infections such as what we call bacterial vaginosis or vaginosis. That is usually as a result of reduced acidity of the vagina, and it can occur during the periods you've mentioned, after the periods, okay, because that's when the acidity tends to reduce. And so you end up getting that bit of discomfort and a discharge and all that. So it's not necessarily normal, okay, but it can occur. The advice is let her come to hospital, let the doctor take off that sample and see what specific infection is this that is taking advantage of these changes.
Okay.
Yeah.
Is it advisable to have sex in menstruation periods? I'm asking because I hosted someone and she said she does it.
Sexual practices are different.
Because they said, someone came in the comments and said, Zubeda, it is healthy. So stop telling people that it's not healthy. Because in my religion, they say it is not even accepted.
I know if I say whatever I say, people will quote it. People will quote it wrongly. But it would really seem uncomfortable.
Uncomfortable?
And in terms of health, we do not have a specific restriction of when to have the sexual intercourse. But if someone is bleeding, that would not be an appropriate time to have intercourse because infections can easily be transmitted. If someone, if someone has a sexually transmitted infection, or for example, if someone has HIV, during the time of bleeding, that would be the time of the most risk of transmission because of contact with the blood compared to contact with vaginal fluid. You get it? So I would recommend that during that time, it may not be appropriate for you to engage.
Abstain.
But I know there are people who will say, I don't have HIV and all that, so
I want to say you are lying.
Yeah.
Okay, so Dakoralero, but your doctor, I get the infections, recurring infections, diro ino kujja mu ddwaliro, tulekerawo okumira eddagala ne tusalimalawo, mulekerawo okwejjanjaba. Mumira antibiotics ne mwonoona immunity yammwe. So abasobola okugula cranberries wano bangambye za layisi.
Yeah.
Yes. So Dr. Eladdu ali ku TikTok ya joininga ne ku YouTube.
Yeah.
Whoever go tutabuuliza kibuuzo kye, please comment in the comment section. Next time when we are here, tugenda kuba nga tubuuza doctor because ekintu kya infections kati twogedde ku z'abakyala bokka.
Yeah.
Yes, then because waliwo n'ez'abaami ng'ate nabo balina ebizibu byabwe naye abakyala be basinga ndowooza okubeera ne infections buli ssaawa. So thank you, doctor.
Thank you,
we love you so much.
I appreciate.
Thank you, Ugandans. Mwebale kundaba, mwebale kutwagala, mwebale kwagala TMR, timu yonna. Yes, nange wamu. Njagala okubaagaliza ka weekend akalungi era njagala okusaasirako kasuku olw'okufiirwako jjajja badde bamujjanjabira wano era badde baakamusiibula. Kyannaku nti we baamuzizaayo ennaku ntono nnyo ate jjajja ne tumufiirwa. So nga executive media ne Zubeda mukwano gwo njagala ne TMR at large njagala okutegeeza nti tuli wamu naawe, tulumwa wamu naawe, Omukama akugumye. Musiibe bulungi, mweraba.
Thank you.
Executive Media. Focus, innovate, succeed.